Hi, Steve.
Hi, Andy. How are you doing?
I'm good, thank you. I hope you're well too.
Very good.
Can I ask you to, first of all, thank you very much for agreeing to be interviewed in this way. Can I ask you to introduce yourself, please?
So, hello, my name is Steve Dunn. I'm Chief Executive of West Suffolk Foundation Trust. We're an integrated trust. We provide both acute services in Bury St Edmunds and community services right across West Suffolk, some social care services and some GP services from the 1st of April in Glemsford.
Yes, I heard about that. That was good news. Thank you. And I like the way that you started off with hello, my name is. That's a nice reminder. So, Steve, my first question is this. It's how are you looking after yourself and how are you supporting your teams during this pandemic?
Well, so this has been a really challenging time for everyone, both within the NHS, within the health and care system and setting across public services across the country. Andy, as you, I think, are well aware, it's a very, very strange time, something we couldn't have predicted a few months ago, how dramatically the world has changed. Certainly with this pandemic, staff have been very much on the front line, and I think that's been recognised in the clap for carers and the support that's been out there in our community for health and care services, and we really, really do appreciate that support from the public. But one of the things that we've been doing is thinking about how we help staff get through this challenging time. Certainly what we've started off doing about our preparations is planning for the worst but hoping for the best, and we've had really good plans in place, and we've worked with colleagues right across the public sector and the voluntary sector and beyond to try and create capacity in the NHS to meet the surge, or the first predicted surge, that the country has seen. Around that, we've done lots to try and support our staff. So this has been our number one priority for the trust, but we've put in place lots of very, very simple things for staff. We've given them free teas and coffees in the organisation. We've given them free car parking right through the pandemic. We've also changed rotas considerably, so we've had more people working overnight and more senior people on overnight, and we've done things like give food and make food available and hot food available through the night, so staff can be supported. We've had an outpouring of support from our community and donations into our My Wish charity, whereby what we have been able to do is to give staff welfare packs. We've been able to furnish things like calm rooms, quiet spaces, so staff can go and have downtime during their busy days. We've also put in place, and I'm very proud of this, some additional trust psychological support. So we've got an amazing trust psychologist called Emily Baker, Dr. Emily Baker, and we've also put in place additional support for teams, especially when they've been dealing with a number of COVID deaths in their wards and in their areas, and that has affected some teams quite profoundly, actually. So we've put in place all of that support. We've tried to communicate regularly with staff, give them daily staff briefings, let them know what's going on. We've communicated publicly about the number of both deaths and sometimes positive discharges that we've had, because we've had a number of successful people recover from COVID that we've been keen to communicate, to keep people informed, let them know what's going on. Also address their worries. So PPE has been a worry, personal protective equipment, making sure that people are protected, that they've got the tools to do the job when they're putting themselves in harm's way. I think we've been quite fortunate as a trust to have a good supply of personal protective equipment. There have been a few times when stocks have run low, and when we've let national teams know about that, we've had the deliveries, and that I think has been something that the teams on the ground have appreciated, because we've been always able to communicate that, let them know that we've had good stocks and that we're doing our best to maintain those and ensure that people are appropriately protected. I was speaking to one of our respiratory consultants yesterday, who's been in the front line doing lots of ward rounds in our COVID wards and COVID areas, and we've been rolling out our antibody testing in the trust. And we were discussing whether we'd had COVID. I'm a very visible chief exec, and I've not had COVID, and I was a little surprised about that. And this respiratory consultant was telling me that they hadn't had COVID, and they thought they would have had, because they've very much been in harm's way, very much dealing with patients very much up close and very much fully gowned. The PPE does appear to have worked, and it's not nice, serving patients when you're covered in a visor and a mask and an apron and a gown, and you're hot, and it's challenging. That's been quite difficult for staff. So putting in the support for staff has been really our number one priority. You also asked me about me, and if I look under your face, you're about to ask what about me. This is tough for us as leaders. We're meant to be strong and give direction and support, and all the uncertainties that are there for us. We're all concerned about our friends, our family, our loved ones, our nearest and dearest, and it's been, it has been a difficult time. I've had the support of a great team in the trust, and my executive colleagues have really stepped up, and I do appreciate their contribution. I've had great support from the system, people like Ed and yourself and colleagues there. That means a lot. And I'm sure you, like many members of the public, have been using this as a chance to do more running, do more walking, and in lockdown, when we get time out, to appreciate the wonderful place that we do live. Certainly I've had the benefit. I live relatively rural in just outside of Bury St Edmunds, and where we can, and observing the rules on social distancing and so forth. I've been out in the countryside doing runs, and valuing and appreciating where we live, and the fact that at the moment friends and family are safe and doing okay. But our condolences are definitely there. We have lost loved ones right across our community, and I do appreciate that, and we've been trying to do our best for those members.
Thank you, and I'm glad you put yourself there, because I really appreciated what you were describing for your staff in terms of sort of physical well-being and psychological support, all of which is really important. Thank you, Steve. My second question is this. So how would you describe the relationship between your hospital trust and our local care homes in that part of Suffolk?
So I hope this is what our care homes would say as well. But one of the things that we've been working on the last few years actually is something called West Suffolk Alliance. We've got an alliance way of working where both public sector, private sector, voluntary sector organisations that are working for and supporting and serving local people come together on a regular basis. And that alliance philosophy and way of working, I think, has extended into care homes. So we've been doing initiatives such as discharge to assess, whereby we work with local care homes around discharges and discharge planning. And we've had a lady called Liz Patrick who's in post, who's maintained that link relationship between many of our care homes in the west of Suffolk and the hospital and our community teams. And that foundation and bedrock that we established, I think, prior to the pandemic has, I think, since proved itself to be incredibly worthwhile, both in terms of the communication, the support that we've got with our care homes. We've been trying to work with care homes to support additional training around both infection prevention and control. Certainly with the CCG, making sure that care homes have got adequate supply of PPE, where the guidance has changed to ensure that people are swabbed prior to discharge. We've made sure that that is happened, and that care homes are communicated and put in place. Lots of different ways of electronically communicating with care homes to recognise the fact that face-to-face meetings with care homes has not always been possible, and so forth. So personally, I'm very proud of the relationship, the strong, I think, supportive relationship we have with care homes. It's not perfect. We're not perfect as a trust, and we don't always get things right. And there are times when I'm sure colleagues would appreciate better communication and better support. But I am very proud, and I think it marks us out as a system that we have good, long-standing relationships with the care sector and the care home sector across West Suffolk, and I think that has helped us through this pandemic. But I appreciate care homes have had a very, very challenging period.
May I just ask, when the swabbing came in, because you mentioned swabbing, was that from the outset, or was that something that wasn't feasible to begin with?
Well, the national guidance has been changing and evolving on that, and when the national guidance changed, which I recall was in March time, late March, but early April, we made those changes, making sure that we've got sufficient swabbing capacity locally to do that in a timely way. Has always been a challenge, because we've been having to send our swab results externally initially as part of the period. We now have a limited capacity to do some in-house tests, and that has been used and prioritised for our care home discharges. So we've basically followed the national guidance on that, and worked with local care homes to make sure that guidance is followed.
Oh, thank you, Steve. My third question is this: what has been the biggest challenge so far, and what do you think will be the biggest one going forward?
So I think certainly for me, the biggest challenge is dealing with, shall we say, some of the anxiety, the concerns, the massive upheaval in our both daily and working lives that we've seen as a consequence of this pandemic, and to try and give leadership, show leadership. That to me has been a massive challenge, but I have been in awe of people's professionalism throughout, and people's dedication, and actually everyone's got behind our mission to provide the very best healthcare for local people, and to support public through this. And so, we have had challenges around ensuring that we have sufficient PPE, but I think we've been able to deal with that, keeping people's morale up, and focus and appreciation and communicated. That's been I think a big challenge for us going forward. I think the big challenge is the fact that we've, in response to the pandemic, stopped some of our routine, planned surgical operations and outpatient appointments. We've been trying to step much of that up, ensure that routine and urgent cancer is continues, but clearly I think the public has stayed away, and that combined with the fact that we've stopped doing certain things through the pandemic means we've got a big challenge about making sure that there is not an increase in both concerns and complications in terms of people's health. People are presenting late with probably more serious conditions and cancers than they might otherwise would have. So it's really, really important that people feel both safe to come to hospital, or safe to visit local GPs, or safe to receive community care, but also that we stand up more routine elective activity, and we avoid the situation of waiting long for much needed operations and interventions and care and so forth. And I think that will be the big challenge going forward. There's a huge amount of planning that is being done both in the hospital and in the community and with partners about how we can do more and step up more activity.
Thank you. Yeah, that makes sense. Thank you, Steve. My last question is about learning. So what do you think the learning will be from this outbreak?
So it's really difficult when you're in the moment hindsight's always a wonderful thing, isn't it? And there's lots of big and difficult decisions happening nationally and regionally and locally. Certainly, what do I think we've learnt? Well, I think I've learnt about how people are prepared and absolutely committed to their roles. I've said and much remarked as I go around the trust that you see the best of people and the worst of people in these situations, and certainly what I've learned is that people are incredibly professional, very keen and very committed to serve their patients and to be very, very flexible around that. Our world has massively changed. We've transformed some of what we do in a matter of days and weeks rather than months and years because people have recognised that we can't just continue to do things as we did prior to COVID. The fact that we're having this conversation electronically now is a great example of how we've embraced new technologies very, very quickly. We're doing more of this in terms of some of our patient consultations, how we answer and meet either complaints or concerns of members of the public, how we might avoid people having to make long trips into hospitals and surgeries, helping the environment, saving people time, being more effective. So people's both commitment and innovation and dedication, and also giving people the responsibility to bloom and the space and the encouragement to listen and allow them to show the public, show our patients what they can do, I think is something that I've further learnt. And I think we're on a cultural journey at West Suffolk in the community to give more clinical leadership to frontline professionals to allow them to do their job. I think that's a shift that's occurred nationally. It's a shift that we've embraced and accelerated locally. It also enables us to address some of the issues that we've been working through in terms of West Suffolk, in terms of recent CQC inspections as well and so forth. And I think it's a really strong foundation for further recovery and improvement.
Fantastic. No, thank you, Steve, and thank you for answering all those questions so fully. Thanks again for joining me. Appreciate it.
Really appreciate talking to you, Andy, and thank you for all you do at Health Watch as well. We do appreciate that.
Thank you.